part of the Barnsley team are there's 2 paediatric consultants, there's 3 nurses and 2 dietitians as part of our team, and we've also got a diabetes admin as well that's participating in the QI. So if we just go on to the next slide, Kirsty, that'd be great. So the topic that we've decided to try and improve is increasing time in range on downloads to at least 70%, with then an aim to reduce the HbA1c below 48 millimoles in children under the age of 16. So what we found is in our MPDA results that our HbA1cs less than 48 are a lot less than the Yorkshire and Humber and England and Wales. So ours is sat at about 3.2% at the minute, and Yorkshire and Humber and England and Wales are up at 10%. So our aim is hopefully to increase that percentage, that will then kind of come in line with regional and national targets. And we decided to focus on the patients under the age of 16. We do actually see patients up until the age of 22, so it's an even split. We've got about 90 patients that are under 16, and then we've got about 90 patients that are 16 to 22. So we thought it was a bit too much of a task to focus on all of them all at once, so we'd start with the under 16s first. And when we look through our data, we of the 90 patients, we'd identified that at least 72 of these had the capacity to download, so potentially about 80% of our patients can download. Now, whether or not they do, that's another issue, which we'll talk about next. So just on the next slide, it just briefly shows the fishbone diagram that we looked at in ways and the processes to do this, and probably like every other team, there's lots of different things that will have an effect. So we looked at the different types of equipment that we've got, so all the meters, the pumps, the CGMs, all the downloading software that comes with that, and the processes. And obviously, like we've just shown, we have got quite a large cohort of patients that can download, but actually what we're finding is every week it's the same ones downloading. So we could look at, there's lots of things we could look at to try and increase the time in range. So it could have been more encouraging them to do more downloads, so kind of doing text reminders, which again we've tried. So we've looked at all the people that are involved, but the main thing I think that we've come up with is kind of the education, and what resources we've got and how we can help. So we've looked at things like snacks, exercise, and one of the main ones we're looking at the minute is self-management, and making sure that patients do know how to download, and then giving them the kind of that knowledge and that education to be able to look at things themselves and make decisions as well. So we looked at it in different capacities, doing face-to-face clinics, obviously on a virtual platform like we have been doing. Do we need to change clinic summaries? How best are we to do these education sessions? So on the next slide, what we've done so far. So we have weekly QI meetings after our MDT meetings on a Monday morning. So we've got like a dedicated time that we'll sit down together and look at what we've done so far, and then make a plan for the weeks coming up. And what we've decided in that is we're going to do a monthly analysis of the data that we've got, and we'll look at different topics to cover and see how effective they have been. So like I said, the main things I think we're going to do is education on exercise, snacking and self-management. Now we found that we've already done quite a lot of education on the exercise and the snacks, so I think our main aim is going to be looking at self-management, and then updating of things like clinic summaries and using the terms time in range more alongside HbA1cs. So again, our barriers have been time. There just doesn't seem to be a lot of time in the day to get all the work done in preparation, even though we're doing it on a day-to-day level. We are asking for more help within for the QI team that we've got in-house at the hospital, and we're also using the Libra representatives as well to help us with some data analysis, and then hopefully we'll do that on a monthly basis, so we've got a trail of our results. I think from a learning point of view, I think we're still just learning as we go along, and when we go on to the next slide, it shows the results that we've got so far, and I think it's what we have looked at is the DIASEN data for the patients that are downloading, and the LibreView data as well, which are pretty much the same, if I'm honest. We've got we've got timing range at about between 40 and 60%. So we're not too far off. So we just need to decide now what are going to be the best options to encourage the patients to maybe download a little bit more or test more frequently. But everything's fairly consistent from both lots of data that we've got, so that's encouraging. So using that data, I think going forward now, what we've decided, if we just go on to the next slide. So yeah, we found that the results are very similar. The majority of patients are between 40 and 60%, but the time that they run high or very high is at least 40%. So that's kind of given us a plan of what we're gonna focus on going forward. So when we're looking at how to reduce this, again, self-management, encouraging them maybe to do postprandial checks and corrections, make sure that the carb counting is accurate, and then giving out more information in clinics now that they're starting to come back more face to face, but also digitally as well via email. And then I think just the last slide is just some pictures of the education and the resources that we have been using. So the clinic summary is quite new. We've just started using that in the last couple of months, again with more about the HbA1c and time in range. And then there's lots of dietetic input, that we're looking at as well to use, just to make sure that carb counting's on point. And just to continue the education with the patients and the families, really, to make sure that they're happy and up to date with all the latest information.